Okay, Mr. Smith, looks like we're still having trouble controlling your blood pressures. You know, I we've been talking. I know you've been having trouble taking your medications, remembering to take it. And I was wondering if we could talk to one of the psychologists. And sometimes when we talk to the psychologists, they help us with figuring out what the problem is, or helping us get strategies to take medications more regularly or do things more regularly. And they can help us, you know, with different mental cues and stuff like that. What do you think about that?
Yeah, I think that could be a good idea. One thing I believe, I may not need all these medications. I used to run a lot, and I just haven't had the motivation or anything to run lately. So maybe if I can motivate myself to do that again, that would help my blood pressure and everything else as well.
I think that's perfect, because these guys as well are like experts on motivation. In fact, there's a technique we call motivational interviewing, and it's a way to help us motivate the individual to get to that next step. So that's kind of all in the same thing. You know, we can start the medications, maybe we can motivate you to run, work on those skills, and then maybe stop the medications if your blood pressure gets better.
Okay.
All right, I'm gonna step out and talk to Dr. Hoover, and I'll be back in a bit.
Okay.
All right.
Thank you.
Yes, sir. You gonna follow me? Okay. Hey, Marlin.
Yeah.
I got a patient I'd like to talk to you about.
Yeah, sure.
I got a guy, Mr. Smith.
Mm-hmm.
He's a 62-year-old guy with really uncontrolled hypertension. He's had I'm not really sure what his psychiatric diagnosis is, but he does have some paranoia, and he's had some interpersonal issues with his family and pretty much with his entire life, it looks like. But you know, the real big issue is for his compliance with medications, his adherence to medications. His blood pressures are out of control, and he admits to the fact that he just doesn't take his medications. He thinks, you know, if I get back to exercising, I'll be fine, and if I do this. And I asked him, well, I think that if we worked on your medication adherence, I think you would do a lot better. And I asked his permission to bring you in as a strategy to help work with that. And he was open to the idea.
Okay.
I did kind of say that he does know that he feels like he's not motivated enough to run. And I use that kind of as a tool, saying, you know what, part of what the psychologist can do is help you motivate.
Okay.
And we can kind of kill two birds with one stone, and we seem to be open to that idea.
Okay. Well, it sounds like then the main goal would be adherence to plans, both
Absolutely.
the medication plan and a plan to increase his exercise.
Mm-hmm.
So why don't we just list as that we're going to work on both health-related behaviors and psych,
Uh-huh.
which would be the adherence to plans as the main goal.
Absolutely. I think that's to me the biggest issue,
Okay.
because his blood pressures are out of control.
Now you mentioned that he's having significant interpersonal issues. This is ongoing problems with family.
Chronic. This is kind of his course, his baseline course. It sounds like it's kind of who he is.
Now, is he accurately interpreting people, do you think, or is he kind of...
No, there's a statement that says that the common issue with all your failed relationships is you.
Oh, yes.
So I think he thinks everybody else is at fault.
Then I'm probably going to need time to build a rapport with him to be able to reinforce things. So what do you think about half-hour sessions weekly for a couple months?
I think that's a good idea. You're going to have to spend some time with him.
Okay. Well, then I'll plan on weekly 30 minutes, maybe 8 sessions. That's 2 months. Is he really technologically up to date?
Not
or?
really. No. Yeah. He's I don't think so. I don't think he really would be able to grasp onto apps or anything like that.
Well, one of the main things we do with interpersonal problems is something like group therapy. So I'm going to put a question mark by group here to see if there might be appropriate to get him involved in a group who could work to some degree on how he relates to others and how he interprets them. And then because you've got a pretty good rapport with him, do you think?
I think so.
Okay.
We've been working together for quite some time, so I think he trusts me.
Why don't we schedule him so I can see him during your clinic, and then we could just have you step in, maybe work week 1, 3, and 5, just to say it's great that you're following your regimen. You know, if he's following it, or we can problem solve then,
Yep.
and then maybe we can I'll give you a report on the other weeks, and you could give him a 1-minute call just to reinforce the behavior change. Does that sound?
I think that's wise. I think if I reinforce what's going on, that will probably build the rapport, between you two as well.
All right. Well, why don't I go ahead and meet him with you, if that's okay, and then I can get started with him today.
Absolutely. I'd love to introduce you to him.
Morning.
So Dr. Hoover and I talked a little bit. I told them what we talked about the blood pressure control and the pills, and also about your interest in getting more motivated for some more exercise. So is that okay if I leave you here with him and you guys can talk a little bit? And then what I'd hope to do is that he and I will work together to balance your blood pressure and motivation and all that kind of stuff. And so anytime you see him, I'll see you, and we'll work together.
All right.
Sound like a plan?
Sounds like a good deal.
Now, we were thinking about maybe a couple of months that he and I would meet weekly. Does that make sense to you?
No, I think that sounds like a great idea. So we talked about that. So taking some time to get to know you and really kind of working through things to figure out where the roadblocks are and just watch you in your progress through that. So we're thinking probably a couple months, once a week.
Okay.
And will you be here when I'm meeting with him so you can step in and see how he's doing?
Absolutely. This is what we had talked about. What I'll try to do is come in every time. And if I can't, what I'll do is if I miss you on a week, I'll give you a call, just to touch bases and see how things are going.
Okay.
Okay?
Well, if it's okay, I'll go ahead and stay with him now, and he and I can get to know each other and kind of get started today.
Okay. Wonderful. Sound like a plan?
All
All right. Well, I'll be seeing you soon then.
Yep.
All right.
Thank you.
Yes, sir.
So now go ahead and have a chair down and get comfortable.
All right.
Okay. So I understand that you've been working on this blood pressure thing for quite a while.
Mm-hmm.
Well, how do you understand what's happening with that?
I just know my blood pressure is really high. I'm supposed to be taking a few medications for it. I just don't take them regularly. Like I mentioned earlier to him, that I think I don't need to be on all these medications. If I can just get myself motivated again and start exercising, running like I used to, I could have probably a greater impact. I just don't like taking medications.
So now in the past you've been able to get yourself to do that. So what I'm going to do is to turn to you and say, at this point we would simply proceed as a normal kind of behavioral intervention that focuses on the main goal of adherence, both to medication plans and also to his own goals and what he sets for himself to improve his health care. Thank you.